If you live with Hypermobile Ehlers-Danlos Syndrome, you know it's so much more than just bendy joints and stretchy skin. But let's be real, hEDS is a master of disguise, and its lesser-known symptoms can sneak into daily life in the strangest ways. So, let's talk about the wild side of hEDS, the surprising, little-known manifestations that don't get nearly enough attention. First up, let's chat about dysautonomia. Sounds fancy, right? It basically means your body has a hard time controlling things like your heartbeat, blood pressure, and even your digestion. For me, this showed up as postural orthostatic tachycardia syndrome, POTS for short. Imagine standing up and your heart suddenly races like you just ran a marathon, sometimes leaving you dizzy, lightheaded, or even flat on the floor. Not fun. Temperature swings are another uninvited guest. I used to joke I could never wear the right outfit. Sweating buckets 1 minute, freezing the next. My hands and lips sometimes turned blue thanks to Raynaud's phenomenon. Cute, right? Not exactly something you find in a textbook description. Then there's the quirky world of proprioception. That's your body's GPS system, helping you know where your limbs are. With hEDS, my GPS goes rogue. Cue clumsiness, dropping things, and mysterious bruises I don't remember earning. If you're anything like me, you probably have a whole collection of "where did that bruise come from?" stories. Chiari malformation and cerebrospinal fluid leaks are rare, but they're absolutely brutal if you have them. I've met folks in the community who deal with headaches so intense just standing up feels impossible. And let's not forget nerve entrapment, where loose connective tissue lets nerves get squished, causing pain in places like the wrists or shoulders. Carpal tunnel, anyone? Oh, and brain fog. That's the kind of forgetfulness and mental cloudiness that can turn a simple task into a full-on puzzle. For some, migraines are a regular part of life, and not just any migraine. These ones can be more frequent, weirder, or harder to treat. But hEDS doesn't stop with nerves. Your gut can get in on the action. Slow digestion, reflux, constant bloating, and a whole menu of food intolerances. I once joked my stomach had its own personality, complete with mood swings. Dental quirks? Yep. High, narrow palate that makes braces a must, teeth that chip if you look at them wrong, and jaw joints that click, pop, or even dislocate. Swallowing and speaking can get tricky too. Sometimes I sound like I just woke up even at 2 p.m. Living with hEDS means learning to expect the unexpected. If you see yourself in these stories, you're not alone. The more we talk about these unusual symptoms, the more we can help each other, and maybe even teach our doctors a thing or two along the way. Thanks for hanging out with me. If you relate, drop your own weird hEDS stories in the comments. I'd love to hear from you.